Let's talk about the worst health advice to give to Black women and what we have to stop doing. Thanks for joining us again. I am Dr. Swiner. This is Dr. BGV. Let's get into it. There are a lot of things that we need to stop doing, both inside of the clinical setting when you're seeing your doctor and talking about your health, and from a physician's standpoint, what we need to stop telling Black women about their health and wellness because it's not working. We're going to talk about some of those things that we need to work better on so that we can get better outcomes. One that you'll hear a lot is if diabetes or some other medical condition, but specifically diabetes runs in your family, you're gonna get it. It's not the case. That's not the case. Good news is, even if your mama has it, your daddy has it, your grandmother has it, even if more people than not in your family have high sugars, or the sugars, what we call it in the South, even if they have it, it doesn't mean that you have to have it. Unless you're born with something like type 1 diabetes, which is, in childhood and have to, from day one, start paying attention to your sugars. If most of your family ends up with type 2 diabetes, there is actually a lot you can do to prevent that from happening. Not always related to weight, but it certainly can be. So watching your BMI or watching your level of, and we hate having to pay attention to scales, but they do mean something. So if you're overweight or leaning toward the obesity side of the BMI scale, that definitely is important, because the more fat, the more cushion you have, the more weight that you're carrying, the harder it is for your insulin and your blood sugar to balance each other out. The harder your liver and your pancreas have to work to help level out your sugar, the higher your sugars will become over time, and the higher your hemoglobin A1C will be. Check your A1C, by the way, if you haven't had it checked and you know you have a significant family history or you know you're overweight. The good news, again, is even though everybody in your family has diabetes, especially if it's type 2, not type 1, there is a lot that you can do about it. So you can watch your intake of carbohydrates and starches. You can decrease them. That doesn't only include sweets and desserts, but it also includes things we drink, right? So sugary substances, a lot of stuff that we add sugar to and we drink it, whether that's coffee that we're buying, right? Or we're making it at home and putting a bunch of sugar in, a bunch of Kool-Aid, lemonade, drink a lot of sodas, not good for your sugar intake. Also a lot of bread, especially if it's just pure white bread, raises your blood sugar as well. So you want to pay attention to those things. If you can modify your diet, meaning what you're taking in, not necessarily what you're controlling and portion controlling, but the things that you are literally putting inside your body. If you can control that, decrease your sugar intake, increase your activity. If you are on the higher side of the BMI scale, getting close to that obesity range, if you can decrease it, you definitely have a better chance of preventing and maybe even treating or potentially curing. There's a lot of research now on that. Diabetes before it becomes a huge issue and causes a lot of the complications. Let's talk about health maintenance and preventative care. There's a lot of confusion, and one of those bad health tips that I think Black women may hear is, you don't need a mammogram this year, you're fine, or you don't need a pap smear this year, you're fine. That can be detrimental because, unfortunately, cancers can pop up within a matter of months. So if it's been a long time since you've had that conversation with your physician or your provider about when should I start doing mammograms, how often should I have pap smears, that's for your cervical cancer screening, how often should I get them, you do want to ask and have that conversation. There's confusion because the national standards or guidelines a couple of years said one thing, and then they switched, and then they switched again. Every couple of years they change, it seems like. So I tell my folks, particularly Black women, just get them every year. Then there's no confusion. You won't forget, right? Because you go a couple of years without having them, and then you look up and it's been 3-4 years and you haven't had a mammogram. So you won't forget. And if there's something small that needs to be followed up on, you want to have a shorter interval in between the times you have them versus a longer time, so that thing, that spot, that lesion, that cyst doesn't have time to grow and you're not paying attention to it. The earlier you can catch things, the better, even if it's cancerous. about your weight. You know, one bad piece of health advice is if you just lose weight, you'll be fine. Or losing weight is easy. Just do that and all of your worries will be taken away, or all of your health conditions will be taken away. It's not necessarily the case, right? There are clearly things that are related to how much weight we weigh, right? So with obesity, morbid obesity, there clearly are health conditions that relate to that, whether it be hormonal issues, we talked about diabetes earlier, heart issues, blood pressure, all those things, right? There's a clear association between that and how much you weigh. However, just losing weight, number one, can be hard for people, right? And number two, even if you lose the weight and change nothing about the other things in your lifestyle, nothing's really going to change. So it's a complicated topic. It's a sensitive topic. People are very sensitive generally about their weight, particularly women, very sensitive about our weight. And then some patients don't even like to look at the scale when they're getting on the scale at the office, or they turn their backs, or sometimes they ask, can we skip weight this time? And, you know, depending on the situation, sometimes we'll do that. But it's important to know if there have been significant changes or increases in a short amount of time to your weight. And if you are trying to lose weight and you try some of the normal things, you know, you try to exercise more throughout the week, or you've tried to cut back your calories or cut back on fast food and it's not working, it can become very frustrating and it can actually cause a rebound or the opposite to happen. You know, gaining more weight or gaining the weight back that you lost initially. So it's a very complicated kind of multi-layered situation when it comes to weight and how it affects our health. But Black women in particular, if that is an issue for you, then have the conversation with your medical provider. Come up with a program that works for you. There are many different ways that you can enhance what you're doing in terms of eating a healthier diet, getting better sleep, because yes, sleep does relate to your weight, and being more physically active to help with your weight. But if there are other health conditions that aren't really changing once you get to your weight goal, you still may have to do some other things like either take medications or do further testing to see what other things need to be addressed to get to a better health. Let's talk about just praying about it. Girl, just pray about it. Oh, you're stressed out? Just pray about it. Or that man is doing something wrong? Just pray about it. Don't go outside of the house. Don't tell anybody else about your problems. Keep it all in the house. Horrible advice for Black women. Yes. Praying makes a difference. I am a believer. Going to church, getting a good word, fellowshipping with your people, having that quiet time with you and your God makes a huge difference in life in general, right? But sometimes we need a little bit of Jesus and we need a little bit of therapy too, right? We need a little bit of Jesus and a little bit of medication. We need a little bit of our person that we go to, our faith, and something else on top of that, right? Your faith and medicine can go hand in hand, or your faith and something that's considered more outside of that or more alternative or Western medicine related can go hand in hand. They can help one another. They don't have to conflict. They don't have to be mutually exclusive. In terms of mental health, we have therapists, we have pastors who also have counseling skills and talents, or, you know, if they've been trained to do so, you can go to your pastor, go to your faith leader and get counseling as well. Clearly, we have psychiatrists, we have social workers that do counseling if needed, so that you can add that to what you're already doing for your mental health so that you get better faster. Medications, if needed, very effective. You know, there are certain ones in my wheelhouse that I always know will work really well, that people will complain and have many side effects with, that will add on to what they're already doing so that they feel better faster, and that those good and positive effects last longer. While you're still going to church and doing all the things and praying and meditating and doing yoga and etc., and seeing your therapist, all these things can work hand in hand. So don't listen to that. Here's another awful thing that Black women hear about their health. Black women don't need sunscreen. Black people don't need sunscreen. That is extremely detrimental, particularly during the summery months where we're out getting some vitamin D and laying out at the pool and at the beach and on vacation. Black people need sunscreen. Yes, we do have melanin that gives us that extra layer of coverage and beauty, but the sun's rays and UV rays and ultraviolet light, etc., still seeps underneath. For those that, there's some black people that go to tanning beds. I'll pause and gasp on that. There's some black folks that go to tanning beds because they want to be a certain darker tone. Got to be careful. The more unhealthy sun exposure you have to your skin, the more prone everyone, and yes, black folks too, are more prone to having squamous cell carcinoma, having basal cell carcinomas, having little early onset things called actinic keratoses, or like little scaly, little scratchy little moles that just look like little scratches, a little dent in skin there, but it's actually an early form of skin cancer if you don't catch it early. Thankfully, these things can be prevented with a good high SPF. I like to say at least greater than 15, greater than 30, even better, to cover the skin. If you're going to be out, we need to be sunbathing and out and about where you could get a sunburn that you want to apply. And if you're sweating or you jump in the water and the rinse is off, you want to reapply so that you can prevent these things. Y'all take care. Thanks for joining us again for Dr. VGB. Pay attention to those numbers and be healthy.